Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 291. I am so excited to have today's guest on the show. We are in for such a treat. Dr. Emily Parke is an osteopathic doctor who specializes in functional medicine, and she uses an ancestral approach to health. I love functional medicine because it's looking at the body as a whole. It's really getting to the root cause. It's this wonderful bridge for traditional doctors like medical doctors and osteopaths to be able to come into the holistic realm and really help their patients heal on all levels. Emily, welcome to the show.
Thanks, Ashley. I really appreciate you having me on.
I'm really excited because today you're going to teach us, we're going to talk about natural pain management. We're going to talk about healing the gut to support the immune system. We're going to dive into that topic of autoimmune disease, which so many people have these days. And I know you're going to teach other things today that we all could benefit from. So I'm really excited to get started. But first, I'd really love to hear your story. I know that you have so much experience in the medical field. I was really impressed to hear that you worked at the Cleveland Clinic. I'm a big fan of one of their doctors, Dr. Esselstyn.
Awesome.
Have you ever met him?
No, I never got to meet him.
Well, I know it's like saying, "Oh, you're Canadian. Do you know Bob?" So
Right. Totally.
Please share your story. I'd love for you to go back
Yeah.
and go as early as your childhood. Let us know what made you want to become a doctor and a healer and help people.
Yeah. So when I was a very little girl, I was that kid that was excited and enthusiastic about everything. I wanted to try everything and get into everything and experience everything. And I even have a picture dating back to, I think I was like maybe 2.5 or 3 years old. And I got my first like stethoscope set, it was like Fisher Price, like totally plastic, little stethoscope with like a syringe and whatnot. And that, was my favorite thing to kind of play when I was a kid. So it started back then, but I really didn't get a true kind of passion and feel for medicine until I was a teenager. And my very first job was actually at a CVS pharmacy because, I was 16 and I was like, I want some extra, spending money and what can I do? And I just started as a regular cashier. But back then, you didn't need any extra training or certification like you do now to work in the pharmacy. So the head pharmacist was like, yeah, you seem pretty with it. Do you want to, come, work in the pharmacy with me, be a pharmacy tech? And I was like, sure, and and so I did, and started learning about medications and medical conditions, and was really, loving that. And then I had a friend of a friend who was volunteering on a local ambulance, and it sounded really cool. The story sounded awesome, and he was like, "Well, why don't you just, come along for a ride along sometime?" And so I said, "Sure." And of course, I loved it. I thought that was awesome. And then the knowledge that I had gained, from my experience at the pharmacy, kind of learning about medications and medical conditions, kind of was coming in handy on these ambulance rides. And so next thing you know, I become a volunteer at age 17, start kind of pulling a lot of volunteer ambulance shifts and start to get some actual training. I took the first course I took was called the Certified First Responder, CFR. So I took that, and then I took the EMT course and kept volunteering on the ambulance. And when I went away to college, I was pre-med biology, and I kept volunteering on an ambulance during my college years too, and just seemed to have a good aptitude for it, and I loved it. I thought it was just super fun and exciting. And first year of college, I was like pre-med biology, and I loved my science courses, but all the other stuff I was like, not so into it. Which now, of course, if I could rewind, I would, I might, I love the diversity of college and taking different courses outside of your kind of main interest. But back then, I kind of had a one-track mind about medicine and my just love for it. So I switched schools, and I actually ended up getting an associate's degree in respiratory therapy. So I was completely a respiratory therapist to start. And I picked that specialty out based on the description of many specialties. I looked at nursing, respiratory therapy, being an x-ray tech, an ultrasound tech, all different kinds of fields. And I picked that one out because that had really good patient interactions and, a lot of, cardiorespiratory science to it, which I truly loved. And then I stayed on and got my bachelor's degree from the same college in cardiorespiratory science. So that was kind of, so I have a very, medical background, right, from the start, but, starting all the way from an ambulance volunteer, pharmacy technician, ambulance volunteer, then went to respiratory therapy school, started working respiratory therapy part-time for the rest of my college years and actually all through medical school too. But, it wasn't until I got into respiratory therapy school where one of my instructors, who I love this woman, her name is Kathy Beanie. Kathy, if you're out there listening, thank you so much. She would put us on rounds as respiratory therapy students with the medical students at the university. And she noticed I started kind of saying answers to questions that nobody else was answering. So she started like poking me in the back, like, speak up. So long story short, I kind of was like, well, if those guys can do it, I totally can do it, and so that really catapulted forward into, me, of course, taking the MCAT and applying to all different kinds of medical schools. And I really liked the osteopathic medical school kind of mantra back then because it's really more holistic. They really do take a look more at the whole person. And of course, with the osteopathic manipulation, there's a big, right then and there, like they fully realize there's a big mind body connection and a big connection between like the physicalness of your structure and health. And so that resonated really well with me. So so I went to medical school and was working, like I mentioned, as a respiratory therapist during that time too. And same kind of thing happened in medical school that as it did when I was a kid. Like every rotation, I was like, "This is amazing! I want to do this." I just like loved it all. But I did end up choosing anesthesiology as my residency because back then it was just the anatomy, the physiology, the pharmacology. Like you literally had to know something about just about everything in order to do it. And you had to make decisions really quickly. And it's one of the only specialties that there was lots of hands-on stuff. Like you were, putting tubes in and lines in. And, if there was something going on with the patient, like you had to figure it out. Then you went over to the drawer and took out the medication and figured out the concentration and drew it up and gave it to the patient and saw the effect of, their physiology on what you just did to them. So it was one of the only specialties that was completely closed loop. So if you think about it, a lot of specialties are like the doctor writes an order for something and a nurse follows through on it, or the patient picks up the prescription, or, it's not very closed loop. And so I actually really, loved it and loved the complexity of it. And of course, as you mentioned, I went to the Cleveland Clinic to do my anesthesiology residency there. And that was an amazing experience. I loved the Cleveland Clinic. It was my first truly, truly diverse experience. And, I remember kind of walking in from the parking garage every day and you would literally hear like 8 different languages on the way in, which I loved. I had friends literally from all around the world. And of course, it's a huge tertiary training facility and it's always in the top 3, hospital systems in the country and always has been the #1 cardiac center in the world. And it was just a great place to train. But then, as my rotations went on, I kind of had the same issue I did, all along. I kind of loved everything and was like, oh, I want to do a fellowship in something and had a hard time choosing, what I wanted to do just because I liked, so many things so much. But I did end up choosing to do a fellowship in pediatric cardiac anesthesiology. And I ended up doing that at CHOP, the Children's Hospital of Philadelphia. And so after my training, I interviewed all across the country, by the way. I was like, open book, like, want to find a new place to live. I'd only lived on the East Coast or Midwest, through my training. And, I grew up in upstate New York and I just wanted to experience something different. And so I interviewed all across the country and chose a job here in Phoenix, Arizona. And a big part of that was I actually had some friends that were a good group of friends from residency that had taken jobs out here. So I thought, I've never lived anywhere south or west. If I don't like it, I can, move away in a year or something. And that was, in 2009. So I'm still here, but
Arizona, that's such great weather compared to upstate New York.
yes, yeah, exactly. No, I grew up with mostly cloudy days and now I have mostly sunny days. So it's definitely a nice switch.
Before we go forward in your story, I'd love to ask you a few questions about osteopathic medicine, just because I don't think a lot of people know about it or understand
Sure.
it. Is it kind of like taking a medical doctor and a chiropractor and a naturopath and mixing them together?
I would say it's actually more like my experience with it was it's the exact same allopathic classes plus an osteopathic manipulation curriculum. So there's I would say there's almost zero kind of naturopathic type medicine to it. Like my training was still pretty devoid of, you know, lifestyle factors. Um, that came later when I got functional medicine training, but yeah, but we did learn a lot about the body and structure and how structure affects health.
Got it. Got it. So, what had you see that becoming an osteopath was an option? Like, most people just only know that of medical doctors. They don't know that there are all these other kinds of doctors available. What
Yeah.
had you go, well, that is so much better than an MD for you?
Well, so a couple factors. One was my non-traditional background. So back then, when for medical school applicants, they really wanted like the pre-med biology degree, which I no longer, being a respiratory therapist, I no longer had. And I was thinking, well, awesome, I've got 4 years of cardiorespiratory science. Like, doesn't that make me a better candidate? And it actually they back now they look at it a little bit differently, but back then it was not like kind of the preferred method. And on top of that, osteopathic medical school, like they do have a more holistic kind of approach. And I think they tend to be, spend back then anyway, like they would tend to spend a little bit more time with patients and, tend to be maybe a little bit, more personable. And these are things that I've heard over the years of people seeking out me
Mm.
because I am a DO versus an MD. And of course, we all know that. And believe me, I have a bazillion friends that are amazing MDs that are very warm and personable and great practitioners. It's not to say you can't really pigeonhole people like that, but that was kind of the perception, back then especially. And I had lots of classmates in osteopathic medical school that were chiropractors and physical therapists and nurses, and so I think the osteopathic medical schools kind of knew and understood that us with kind of health professional backgrounds, I made really good medical students. But the traditional medical schools kind of didn't, see it the same way. Um,
Interesting.
yeah, and it was actually a great fit for me because even on top of osteopathic medical school, I actually did medical school in a completely different way that has been totally embraced now. I did a complete what's called problem-based learning curriculum, which pretty much all the big medical schools have integrated a good portion of that into their curriculums now. But back then, I was like in the second class to have done it at my medical
Wow.
school. Yeah, so it was really cool. So what that means is instead of because you think of the first 2 years of medical school as like sitting in a classroom and just having information just blown at you. um, and this was very different. This was six of us, and we were in a room together with a physician moderator. And we started right from the start looking at patients instead of like, molecular formulas or anatomy or pharmacology or things completely separate. And so we had a
Wow.
case in front of us. Yeah. So we learned like everything down to the cellular level based on a case and a patient. And geez, medical school was 2000 to 2004. And I can tell you to this day some of the case studies that we did back then, because that's how powerfully it kind of ingrains in your brain when it's connected to a person and outcome versus just I need to pass this information. I need to, like, pass this test with this information that's been, shot at me.
That's amazing because that's a lot like Montessori.
Yeah.
or like Waldorf, where they give you a project, and then it's like okay, we're gonna put on a school play, but then the kids have to learn how to sew, and they have to learn how to paint, and they have to learn how to write a
Yes.
script, and they have to learn, and
Totally.
so they end up learning spelling because they write a script, and they learn, you know what I mean? They learn math because they have to measure, because they have to cut the clothing. And so it's just like you end up, and they have to learn how to budget. And so
Yeah.
because the project challenges them to learn 20 different things that really stick with you versus, okay, today you have to learn XYZ and there's nothing to apply it to. You just have to like, just take my word on it. You have to learn this. I love
Right.
that. That's phenomenal. And so that you're saying that the other medical schools are catching up now with this type of
Yes.
learning?
A lot of them have integrated that in because traditionally it used to be 2 years of complete classroom and then your second 2 years were complete clinical. And, for us in the problem based learning curriculum, as I mentioned, we were already dealing with kind of patient cases. Now we still had exams. We definitely, we didn't have the paper and pencil, anatomy, physiology, pharmacology, separate kind of coursework exams. But our exams were 1 hour oral exams with a physician. Like, so there's no, there's like there's no BSing your answer. Like you're face to face with a doctor who's testing you.
Uh, wow,
So
that's
yeah.
cool.
Yeah, no, it was great. I'm super grateful for having done my medical education that way.
So you moved to Arizona
Yes.
with this wonderful training that you have, and you
Yes.
wanted to help people. How did you discover functional medicine? Like, is it because you felt something was missing in your practice, or why did you decide to dive into functional medicine?
Oh, this is a good story. Okay, so no, so when I first got here, I was, bright-eyed and bushy-tailed and ready to kind of, begin my career, and I did it. The first year I was working, I had a great time. It was it's a huge learning curve. I think what some people don't understand is, when you transition from being a trainee of any kind to being what's called an attending physician, the responsibilities shift from like a bunch of people, and at the end of the day it's not the trainee's response, like ultimate responsibility, to being 100% on to you. And so my very first year I had a great time, met lots of great people, worked a ton, and it was just it wasn't really by choice. It was kind of like this was the job I took. These were the hours, and it was 70, 80 hours a week, and on call nights, weekends, and holidays, and all that kind of stuff that's to be expected with an anesthesiologist, especially peds and peds cardiac. And so long story short, after doing that type of work for a few years, I started to burn out, and it I didn't really realize exactly that at first. What started happening to me was I started having issues not sleeping, and I started having some stomach issues, and I've
Mm.
always been a super healthy person. I was literally to the doctor, once a year for my annual womanly appointment, and like that's it. I never really, got sick too much, and I was very fortunate in that way. And so when these kind of symptoms started happening, and the symptoms were really, it was still, it, now I know they're definitely burnout, and it was always great if you were my patient because I could give you nothing less than 100%. But me personally, it definitely, that kind of work definitely took a toll on me. And I was completely unaware, Ashley, of like the mind body connection and of the stresses that were coming my way, because I was always that person in, a code or an emergency situation that people would say like, wow, you handled that really well, or you were so calm and cool. And then on the inside, that sympathetic tone just kicks in and you're in fight or flight. And I had a hard time kind of shutting that part off. And subsequently I ended up, like I was mentioning, with kind of difficulty with sleep, and I ended up with some stomach issues. And so off I go to a very good regular doctor, supposedly, right? And it's a referral from a friend. And so I go, and this is my first time going for any type of like, symptom or issue. And I'm in my, younger 30s. And, the doctor spends a decent amount of time with me, just kind of marching through the typical medical history and all that kind of stuff. And at the end of the appointment, he was like, "Oh, okay, so you don't have trouble sleeping. Do you want some Ambien?" And I was like, no, that sounds crazy to me. I want to know why I'm not sleeping. So that was the first moment that I was like, I want to know why. I don't just want to take some pill. And same thing with the stomach. They were like, oh, here's this, PPI, this proton pump inhibitor. It'll shut down the acid in your stomach. You'll feel better. And I was like, huh. But still, why am I feeling the way I'm feeling? Those questions were, unanswered. And so that interaction really sparked my interest in, okay, how else can I skin this cat? Like, what else can I do? And I had a friend who had been going to acupuncture, and she didn't tell me why she was going to acupuncture. She was actually going, I found out later, she told me later she was going for fertility, but all I heard from her was, that she was sleeping so great and she was having an amazing, time with sleep, and she had had such a hard time before. And at that time, sleep was one of my main, nemesis. So I was like, I'll do anything to get a good night's sleep. Acupuncture sounds good. Okay, cool. So I of course, started going for acupuncture, and wouldn't you know it, acupuncture and Chinese herbs got me sleeping really well. And I said, okay, well, let's dive into the stomach stuff, and helped really well with my stomach symptoms. And it worked so well. I was like, okay, well, how can I learn this type of stuff to help my patients? Because as part of my anesthesiology job, I was also vice chair of the pain department at Phoenix Children's Hospital for a couple years. And I was seeing kids with, terrible pain issues, just like adults. And we didn't really have any better answers or options for them, which was really disheartening to me. And so that drove me to get training in medical acupuncture. And so I did. I took, complete training course for acupuncture for physicians, and myself and another doctor got the acupuncture program kind of up and going at Phoenix Children's Hospital inpatient. And we were also doing some outpatient acupuncture for adults at one of their pain offices. So that acupuncture training, it was the first education process I had that was like, ooh, what's all this quote other medicine about? It works and it sounds awesome. And one of my classmates, when I was going through training, she actually mentioned the term functional medicine to me, and I was like, what is that? And there were other people in the training program kind of doing some other integrative practices, and so I started learning about it and really did my research. And I was like, you know what? I did my residency and fellowship at top places. So why wouldn't, if I'm going to do functional medicine, like, why wouldn't I, try to get the best training I could for that as well? And so I researched, and that's how I found the Institute for Functional Medicine. And I loved that they had a complete certification process. Like, it was very clear what the curriculum was, and that you had to actually take and pass a written exam as well as a case study exam in order to become a certified practitioner. And so I started 2013, I want to say, is when I started training. So what's funny, Ashley, is that was before the Cleveland Clinic had its affiliation with IFM. That happened that happened a little bit after I started. I thought that was just
Oh, that's
really,
neat.
really cool. Yeah.
Great confirmation.
Yeah, it was really cool. And then, in 2014, the Cleveland Clinic paired up with the Institute for Functional Medicine. And of course, Dr. Mark Hyman and Dr. Patrick Hanaway were the two main docs that kind of went out and opened up the Cleveland Clinic Center for Functional Medicine. And they've been there since 2014, and their clinic keeps growing like crazy. They keep having to find new space, and there's well over a 2,000, wait list of patients waiting to get in. And they're there comparing, healthcare costs and outcomes of traditional medicine to functional medicine, which I love. And I love that the CEO, Dr. Toby Cosgrove at the time was like, yeah, this sounds great. Let's do it.
That's so awesome. I'm really amazed and in awe of you that you were able to get a hospital to accept acupuncture.
It was not easy. It was we had to, myself and the other doctor's name was Dr. Dennis Tong. Hi, Dennis, if you're out there. Dennis moved to California. And it because it didn't exist at Phoenix Children's. And so it was like reinventing the wheel. And there were definitely some heated conversations at times about wait, okay, so you're going to do acupuncture just for headaches and just for nausea. And we were like, no, it's for everything. Like it was really hard to get, the concepts kind of, across, and how to do the credentialing and all that. Anyway, but that was years ago. We got that up and going. And the acupuncture that we were doing for inpatients was pretty much just pro bono, because because it's still complementary and alternative medicine. Insurance does not, reimburse for it as an inpatient, because it's, considered, non, essential care. But we would still do it when we could, and when there was extra time, because, both Dr. Tong and I really, enjoyed acupuncture and loved it. And then, of course, we got the outpatient clinic kind of up and going for adults and kids at some of the private practice pain offices through our anesthesia group.
What kind of results did you see when you and your other doctor friends started to use acupuncture in the hospital? Like, did you guys see that, like, a decrease in having to give pain medication, for example?
Yeah, it was really like, and that's great, because those are two things in anesthesia, pain and nausea. Those are two big, medication driven treatments. And a lot of patients, of course, if you give, pretty much all pain medications, all the opioid medications certainly,
Mm-hmm.
have nausea and constipation, and some other, respiratory depression, have a list of side effects that happen just universally, like they just happen. Um, and of course, so it was always nice to have another tool in the toolbox. Like, okay, we can do some acupuncture, right after, depending on how old the kid was, right after they went off to sleep, or sometimes in the PACU, which is, the recovery room, and really helped with, pain and nausea symptoms. But honestly, the more patients we saw were really outpatient based. And that was interesting, because at first we were getting like all the cast offs. So we were getting like all the patients that, the pain doctors had done everything on. Like weren't responding to, all the medications, and they'd done all kinds of epidural steroid injections or other injections or procedures or surgery. So we were getting like the really tough patients at first. And it was just really rewarding to get really good results, especially when patients were able to come consistently. And that's, true of anything that has to do with body work. You really do have to come consistently at first in order to get good results, especially for a chronic problem.
And the concern is addiction as well. And or for those who have addictions already, they're looking for an alternative so that they don't become addicted to a pain medication. And that there's this safe and effective alternative that more people need to know about, is so brilliant that you were able to bring that into the clinics in your area. So good on you.
Oh, thanks, Ashley. Yeah, no, it was great. And there was also we had a good, amount of patients that were, productive members of society who worked and had jobs, and were like, I can't take this oxycodone and drive, or I
Right.
can't take this and work, and I need to work. And they didn't want, to actually do it. And so acupuncture was really helpful for those patients too.
Very cool. Well, I love that, and thank you for letting listeners know that there is that hope. That acupuncture is so effective on so many levels. So you went to the Institute for Functional Medicine. As you were taking their training, now is it all online, or do you have to go somewhere?
Well, back when I did it, I had to, it's changed now. It's much more, I think, convenient now. But I actually went all around the country taking their modules, and there's 7 total modules to get certified in functional medicine. And the very first one is called AFMCP. It's called Applying Functional Medicine in Clinical Practice. It's this big week-long training that kind of teaches physicians and other practitioners how to think about patient care in a different way, and how to kind of apply the principles of functional medicine. And then the rest of the 6 modules are all what are called, advanced practice modules. And so they get really specific. There's, the GI module, there's a detox module, a hormones module, et cetera, et cetera. So, going through all of that training was really great. And it's not just like the curriculum is set up so that it's not just in-person training. There was, pre-course work that you would do, and then you would go in person for the modules, and then there was post coursework that you would do. Then of course, like I mentioned at the very, at the end of doing all of that, which it, takes back then it would take about 2 years, maybe a little bit less, to complete all of the training, and get, actually certified. And that's what I did. So I actually reduced my anesthesia work hours. I started working part time. The burnout stuff I was describing before. I could use it anyway, and so I reduced my anesthesia work hours so to make time for acupuncture training and functional medicine training. And so I marched through the IFM's curriculum, just fully embracing it, loving it, constantly listening to like podcasts and webinars and summits, and like eating up anything I can. I just truly have a passion for it. And in 2015, I was like, okay, it's time to actually start doing this. And so that's when I kind of, cut the cord and opened up my own practice for functional medicine and acupuncture. And it's called Arizona Wellness Medicine. And it's located here, technically in Paradise Valley, Arizona. It's very close to Scottsdale. It's literally right across the street. And it's been an awesome journey ever since.
Wow. When you first opened your doors, what did you do to attract your patients, your clients?
Yeah, exactly. Because it's not like I was having my, old anesthesia patients come in for functional medicine and acupuncture, right? Like, it's not like you're switching from a primary care, to something else. So, I started really slow. I started with, opening up half a day a week. And the next thing you know, it was 2 half days, and then 3, and then full days, and then so on and so forth. And, I'm super fortunate today. The clinic is, fully booked, and, with the 3 to 4 month wait list to come see me. And I've got other practitioners up and going now because there's just such a need for this type of medicine. And, I want to be able to extend my, healing network outside of the people that I can just see face to face.
I'm so curious. Did you just hang up your shingle and people just drove by and started going, "Wow,
I
I should
wish.
go there," or like
Oh,
what did
Lordy,
you
no.
do to get like a brand new clinic? What did you do to get
Yeah.
people in the door?
Yeah, okay, a lot. A lot of time and effort. And honestly, Ashley, like I was always, I had been in training, and then I was always working for someone, so I had no idea about the business parts, right? And I was so naive. I was like, "Oh, I'm just going to have this little practice with myself and a medical assistant, and that's it." And even with that, there's still a certain number of things that like have to be done, and accounts set up and all that stuff. And and now I'm in about a 2,000 square foot location with 5 total treatment rooms slash exam rooms, and we have an infrared sauna, and we have a biomat, and we have an in-body composition scanner, and we've got 5 staff members and 4 of us practitioners, and so it's just been awesome. But no, to for marketing and whatnot, I joined a networking group. I would constantly go to any of the local like reps for labs and supplement companies, and just network with people. I started right from the start. I started writing blogs, and so I was doing that, and kind of getting those out through social media, and then this past year, I started doing a lot more video content. And so there's lots of avenues, and just face to face networking, meeting other physicians. And then as people come and get good results, then of course they're referring their friends and family, and so on and so forth. So that's kind of how the business grew on its own.
Nice. Well, congratulations.
Thank you.
I'm interested to know what kind of sauna do you have in your clinic? What brand?
Yeah, so and I've had this one since 2016. I got the Sunlight and M Pulse Believe that does the full spectrum, it's near, mid, and far.
I just had Alicia from Sunlighten on the show, and
Nice.
I've also had the co-founder Connie Zach on the show. It
Oh,
took me
sweet.
2 years to decide which brand I was going to go with because I did a lot of I did my own research, and that's the
Awesome.
company I chose. I just think it's so cool that you kind of you came to the same conclusion I did in terms of how great Sunlighten is. That's neat. And a biomat.
Yeah.
I never hear anyone talk about the biomat. I have a biomat. I gave it to my friend with
Love
breast
it.
cancer, and she's been using it for the last 2 years.
Awesome.
So I'm not asking for it back. I'm like, here, you can have this, and I keep checking in on her, making sure she's using it because the
Yes.
biomat's awesome. That's so cool. I thank you for talking about your business. I think
Sure.
that's a lot of people who go into go into any kind of medicine, whether it's a health coach or an acupuncturist or a massage therapist or a doctor, um, there's it's always a surprise how little business training is given in school,
Oh
and
my God, none.
none. And I see so many naturopaths fail, unfortunately, because they're just not set up for success, and the world needs them. People need these
Yeah.
practitioners, but there's really no good business training for them. And so for you to take a moment just to share what you did so that all the practitioners who have their own businesses or aspiring to can can learn from you, so thank you.
Yeah.
When you were going to the Institute for Functional Medicine, traveling around to those 7 modules, can you share with us an aha moment that you had? Like, oh my gosh, I can't believe this. Like, can't believe, either it went like totally against what you'd learned in medical school, or it was kind of like this, I can't believe they don't teach this in medical. So did you have a few of those aha moments that you could share with us?
Oh my God, I've been giggling since you've been starting to ask this question because there was like a bazillion of those moments. um, Mostly, honestly, mostly like what was happening was when information, because and I'm very, very glad I chose IFM because literally every single slide that comes in front of your face has a research reference. And it's not just someone standing up there saying, I did this for my patients and it worked. You should try it too. It's like, no, here's the journal article and here's the research and here's what this says. And so honestly, there were a lot of times where I was straight up angry that this information was not given to me in traditional medical school. Like that was the initial reaction, was like, what? I can't believe they didn't teach us this in regular medical school. Oh my gosh. And so there was a lot of those moments. And then yeah, there's a lot of contradictory things. And so just to give one example of traditional medicine, if you take, let's say, acid reflux. So you take acid reflux. So the traditional medical, model for that is, let's give you this PPI, this proton pump inhibitor, that's going to shut down the acid pump, and your, acid reflux will be better, and you'll feel better, and everything will be great. But of course, right. And now I know I know you've skinned this cat before, Ashley. But for people that are listening, if you haven't, heard this, most of acid reflux is actually caused by hypochlorhydria. In other words, not enough stomach acid. And that's because not enough stomach acid is actually a signal to that lower esophageal sphincter, which is this little muscle that goes between the esophagus and the stomach. And it's a signal to have that thing open up. So then whatever you do have in your stomach goes up in refluxes. So a lot of times the treatment for acid reflux is actually to do things that stimulate more acid in the stomach.
Mm.
And then of course there's also obviously, food sensitivities. And I see that all the time. And those two things actually, like they were non-existent in traditional medical school. It didn't exist. And I have had, of course, lots of patients even since then saying, yeah, the acid reflux medication either didn't help, or my throat stopped burning, but that stuff was still coming up.
Yeah.
you know?
It was still causing, damage or maybe asthma because people
Yeah,
have that,
absolutely.
right, as one
Silent
of their
reflux.
symptoms.
Yeah,
Mm-hmm.
totally. And then not to mention the long-term sequelae that are, well known in traditional, and integrative medicine now. And, traditional medicine, there's some, studies coming out saying, oh, well, people on PPIs, they maybe are at increased risk for osteopenia and osteoporosis because of, less adequate calcium absorption, and then, kidney issues. Those are the two recent, studies that have come up. And then on top of that, in my world, it's like, wow, okay, you need stomach acid to digest your food nutrients. right? And break them down so that they can be properly assimilated. So long term, if you don't have enough acid, you're going to end up with nutrient deficiencies. And then of course, on top of that, if you don't have acid, you're really not breaking down your food particles well. And it can be a source for inflammation in the small intestine and can, create this whole intestinal permeability or leaky gut phenomenon, which is the gateway to so many inflammatory and chronic diseases that we now know. And so there's just this huge waterfall effect for this seemingly simple, take this pill to help this one symptom.
Well, that's sort of what we're seeing now. When you look at it, I had this amazing pediatric doctor on the show, and he said, look, what they're doing to children now with the amount of vaccines, right? Because just to put it into perspective, if you are 35 years old or older, you have less vaccines, and you've gone to get all the vaccines you normally get,
Yeah.
given that you're 35 or older, you still have had less vaccines in your life than a 6-month-old baby right now has.
I know the CDC schedule has changed so much. I'm actually 42, and so yeah, I think I probably had less than 20 or 24 or something like that vaccines in my life.
Right, and so you've had less vaccines than like a 4-month-old, a current 4-month-old. So just to put it into perspective, this pediatric doctor said, and he's an MD, he's not here to bash things like, bash vaccines, but he's here to do true informed consent. And so he said, look, we give these huge amount of vaccines, but there's no safety study to prove that the amount, like the CDC schedule is actually safe currently. And we give all these vaccines. What does it do? It artificially ramps up the immune system so high that he says, there's a good chance that this, in addition to everything else that accumulates with it, is a contributor to autoimmune disease. And it's because it artificially ramps up the immune system. And so they put that person on an immune suppressant, and 5 years later, that person gets cancer. So they get to be put on another drug. And it's that, like you said, waterfall effect, or domino effect, where it's just was one thing that doesn't seem like that big of a deal, creates another thing, creates another thing, creates another thing. And we need to keep coming back to look at the world right now, look at the statistics. Between 1 in 2 and 1 in 3 people will have a diagnosis of cancer in their lifetime. 1/3 of the population is pre-diabetic or diabetic, becoming obese. Heart disease is on the rise. Many diseases, chronic lifestyle-related diseases are on the rise. And if we want to be a statistic, we should just keep doing what everyone else is doing. But if we don't want to be a statistic, we need to turn to the type of medicine that supports the body's ability to heal itself and start questioning everything, right? Start questioning, well, like I love what you did when you went to a doctor. You're a doctor and you're very well educated, and you went to a doctor going, I don't understand, why can't I sleep and why do I have these digestive issues? And instead the doctor's like, here's this pill and here's this pill, and you're like, well, that doesn't fly. And that's everyone's experience. That's everyone's experience of going, to a doctor these days. And you're like, well, no, this isn't right. And I love that you have that mindset of, I need to understand why. I'm not just going to be a sheeple and take a pill and not question. And so it's people who question everything that will prevent themselves from becoming a statistic. So I love that mentality. I want to have all of us adapt your mentality to question.
Yeah, and you know what? My best patients are those same question patients. They're the patients that I actually love when patients come in, fairly pre-educated, because I think it makes for, a better conversation, a higher level visit, all of that stuff. Which is interesting because a lot of, traditional medicine, if a patient comes in with information or a research article or this or that, and I think it really, I don't think it's necessarily the doctor's fault, because I think of how I was trained, and even in osteopathic medicine, and it's true for allopathic medicine as well. There was almost this indoctrination of, oh, that other stuff doesn't work, and it was almost like, if you haven't heard of it, it must not work. It's like that chiropractor stuff, nah, that naturopathic stuff, hooey, and it's, which now, obviously now is completely insane to me. and I could, obviously doing what I'm doing now. But I get patients, coming in with those experiences from other practitioners, all the time. And it's like, oh, that functional medicine doesn't work. And I was like, oh, and I love this now because I get to say, oh, well, have they heard of the Cleveland Clinic? Like I get to, kind of say, or just, go on to Medline and pop this search in, vitamin D and multiple sclerosis. You're going to find a bunch of articles on it. You know what I'm saying? Like it's now we have the evidence to back everything up.
Absolutely. You mentioned food sensitivity testing. Is there a lab that you really like?
Okay, so I'm going to start with this is a great question. I'm going to start with kind of what I how I counsel my patients with this issue. So there's to kind of go back it up a little bit. There's three big kind of areas. There's food allergies, food sensitivities, and food intolerances. And food allergies are IgE, so immunoglobulin E, meaning the immediate immune system's response. But most issues with food are not IgE. So if you eat a food and you have an IgE to it, if you have a strong IgE to it, then when you eat it, you're going to get a symptom pretty much right away. So it could be as severe as, all the cases we've heard about of, anaphylaxis from, having a peanut ingestion and, you start to get the throat closing down and difficulty breathing and all that stuff. But it doesn't have to be quite that severe, but you can certainly have, like nasal congestion or a rash, or your tongue might swell, or you might get diarrhea right away or stomach cramping, but immediate immune system response. And IgEs don't tend to change a ton over time. They can change a little, but don't tend to change a lot over time. Then food sensitivities, which is the, big bulk of it, they can be a little sneaky, right? So food sensitivities are not IgE. They're a completely different part of the immune system and can be many parts of the immune system. So IgG, IgA, IgM, the lymphocyte system, the complement system, and so on. So there is not one test in existence, Ashley, that looks at every single part of the immune system's response. It doesn't exist to date. So for that reason, if someone wants to test their food allergies, we can do IgEs. If they want to test food sensitivities, the company I trust the most is actually Cyrex, and that's Cyrex. And they do IgG and IgA food sensitivity testing using the ELISA method, which is the gold standard. But to be completely honest, and I say this to my patients all the time, since there's not one test that looks at every part of the immune system's response, your body is what really tells us the true answer. And so a very common practice of mine is to walk people through a 30-day food elimination plan with a specific reintroduction process that helps them figure out what their food sensitivities are. Because at the end of the day, no matter what a blood test shows, if you eat something and you don't feel good, that's the answer.
Yes, stop eating it.
Right? Yeah, like don't do that. But here's the thing, it has to be done in a specific targeted way because it takes your body's immune system approximately 23 days to calm down by half. And that's because most of the immunoglobulins, their half-lives, meaning the amount of time it takes for them to drop by 50%, is about 23 days. So 30 days gets you past that halfway point to where on the back end, when you're like, hey, I want to reintroduce this food into my diet, you can actually tell if it creates a symptom for you or not. And I think an important point that I always have to reiterate with people is it's not just the gut. If you get gut symptoms from reintroducing a food, that's a gift, right? Because we all connect food intake with gut symptoms. But what if it's muscle aches or joint pains or brain fog or headaches or a rash? And it literally can come out in any way, shape, or form. And because some of the immunoglobulins are delayed, it can take up to 3 days or sometimes a little bit more to actually have a response to something after the body's seen it. So if you think of, your normal diet, your normal day, like right now, if I was having a symptom of some kind and I was trying to link it to a food, I don't know if it was breakfast, if it was lunch the day before, dinner 2 days before then. It becomes kind of impossible to tell. So that's why, when it comes to food sensitivities, I really recommend, going through a 30-day food elimination plan. And I actually love to use a paleo template for that because it just gets people eating anti-inflammatory, nutrient-dense foods, but it has to be done in the right way. I think there's a lot of people that assume paleo is eating bacon all day.
Bacon and
And
sweet
it's
potatoes.
right, and it's actually like a true paleo plan, how it's meant to be implemented. Half your plate should be non-starchy veggies of some kind, and then there should be a serving of starchy veggies or fruit, and then there should be some healthy fats like avocados or nuts and seeds, olive oil, coconut oil, and then there should be a serving of well-sourced protein like organic grass-fed beef or wild-caught salmon or organic free-range chicken, and so on and so forth. So paleo is really just getting you back to eating real food. It takes away processed packaged food items, it lowers sugars, it takes away a lot of the common food triggers.
I love it. Very cool. Could you just walk us through? I mean, do you think someone should see like you or like a practitioner when doing an elimination diet and reintroduction, or do you think if you taught us today that listeners could do it on their own?
Yeah, so I think most people, your average person can totally do this on their own, and there's lots of great resources and programs out there. And as a matter of fact, at the end of this, I do have 2 free downloads available. I've got 10 delicious and easy recipes that are all anti-inflammatory, nutrient-dense paleo style as a free download. And I also have what's called Dr. M's 3-week jumpstart plan. And those are 2 really good resources to kind of help get people started on eating better and getting ready to do, let's say, a 30-day paleo reset. And yes, I mean, there's so many paleo resources out there now that I'm pretty confident that most people could follow through on their own with it. But there's a couple of kind of key things. One is you do really want to try to eliminate the items that you're taking out for strictly 100% for 30 days. And I tell people all the time, swear to God, this is the only time I'm ever going to ask you to be 100%. Just for these 30 days because and it's to figure out what your food sensitivities are, because there are some people that are highly sensitive. And in other words, if you were like, I'm just going to have a little tiny piece of bread, and you happen to be very gluten sensitive, then those antibodies will go right back up and your clock starts from 0 right at that time. And so, complying as best as possible to get 100% compliance, through the 30 days, and then reintroducing the things that you really want to have back in your diet on a regular basis, one item at a time and one new food. And it's, 3 times a day, 3 days in a row. And then you just track how you feel. And if you feel just as good as you did before you reintroduce that food, awesome. That's a food that doesn't hurt you that you can have back in your diet. And so the idea is not to stay on a super restrictive plan long term. It's actually quite the opposite. You want to get as many foods back in your diet as you can that work for you, but that's how you personalize it to you exactly, because there is not one exact food plan that works for everybody.
And if they feel bad, so they've reintroduced a food and they clearly have a symptom, like you said, it could be brain fog, rash, something intestinal, too much gas, diarrhea,
Yep.
constipation. I get burning, my eyes start burning.
Interesting.
Like, yeah,
Yeah.
I get like this weird burning in my eyes and it just, in my, around my eyes, maybe puffiness. Even just water retention could like, just kind of just swelling up like your rings,
Yeah.
clearly feel like they're, cutting off blood flow to your fingers.
That happens to me too. Yeah. Yeah,
Right.
absolutely.
So if someone has these symptoms from reintroducing a food, do they have to, so they obviously stop eating that food, but do
Yes.
they have to wait and not like eat the restrictive diet again for a whole month
No, no.
before testing
So
again?
nope. So let's say if you have a poor response, you're doing is you're waiting until you feel just as good as you did to reintroduce the next item. So for some people, they may feel good in 2 or 3 days, and for others, it may take a couple, extra days in order for them to get to the point where they feel like they're back to their baseline. Because you do want the slate as clean as possible when you're testing out your foods, because you don't want to go, okay, well, I can't tell if my headache is due to this new food because I kind of had a headache from the last one I reintroduced. You want to just make it really super clear.
And so I've heard of so many different elimination diets. One which was the most restrictive I've heard, is that you eat for a whole week nothing but lamb and pear,
Right,
the
right,
lamb and pear diet. And so you
right.
can have as many pears as you want, and you can have as much lamb as you want. And that's the only thing you're allowed for a whole week. And then you add back and you choose one thing at a time. And if you're, for example, if you want to add milk, you can't just add all milk. It has to be like, I'm adding soft cheese today, or I'm adding,
Correct,
uh,
correct,
yogurt. I just
correct.
encourage people
Yes.
not to do milk at all for many reasons. But
Yeah,
they
I'm with
add
you.
one thing, and so if it's wheat, then they choose, you know, I don't know, they choose to have wheat pasta that has nothing else added to it.
Right.
Not like a
Super
bagel,
clean.
which has a
Yes.
bunch of ingredients.
Right.
And so you're saying add the one thing and then eat it for 3 days with your lamb and pear, for example, and see how you
Yeah.
feel.
Yeah.
What's your example of an elimination diet, meaning the most minimal thing that they should eat um, to get it clean the slate?
Yeah. So I would say about 80 to 90% of people figure out a bunch of food sensitivities and do really well, feel really well on a traditional paleo plan. Then there's about 10 to 20%, and especially the 10 to 20% that don't tend to respond well to paleo, then I might put them on a more restrictive one, like a paleo AIP and autoimmune protocol, which further takes out other known antigens. And I might even start there if I have an autoimmune disease patient in front of me, depending on. And we actually, I always have a conversation with patients about it because, these are long-term lifestyle changes. I tell people all the time, like, there's no rush or race to kind of doing your 30-day reset, like set yourself up for success. There's no food emergency. you know, will you feel better? Yes. But, if you're going on vacation or you're, traveling or you've got guests coming into town, great. Start it after that. But yeah, but most people do great with a traditional paleo. And then, 10 to 20% of the time, we have to kind of get a little bit more nitty gritty with AIP. And then, um, if we still, but, in functional medicine, I'm never doing this in isolation by itself, right? I'm doing all this other, we're doing sleep and exercise and movement, and we're doing stress management like meditation, and we're doing toxin reduction, and we're doing advanced laboratory testing and treating what we find on those tests. So, we're not just doing one, kind of change at a time. But there
Mm-hmm.
and so there are some, and obviously all symptoms are not due to food sensitivities, right? Like, it's very common. And so you have to go through this process to figure out what percentage of your stuff is due to food sensitivities, because otherwise, you will struggle, and you can do all the testing and other tests in the world and not, really ever figure it out. But those 10 to 20% that do AIP and do really well on it, great. If they don't, then that may be the time when I pull the trigger on doing a food sensitivity test. I don't typically like to do them until we're a little bit into the treatment protocol, because if they have a primary gut dysfunction, if they have a chronic yeast overgrowth, if they've got SIBO, if they've if they've got some bacterial dysbiosis, if they've got an undergrowth of beneficial bacteria, et cetera, et cetera, if there's anything going on with the gut, then the chances of them having intestinal permeability or that leaky gut are so increased that if I did a food sensitivity test right at that time, what do you think the results would be? Like, it's going to light up like a Christmas tree with everything that they're eating now. And then what do? You go, oh, don't eat all of these items. Well, that's not truly fixing the root cause of it. You really need to fix the primary cause of that intestinal permeability that created all those food sensitivities to begin with. Does that kind of make sense?
Absolutely. And as you help them clean up their diet, get better sleep, move their body, get maybe supplemental nutrition in them, help them with their emunctory systems to eliminate toxins, they're going to start to feel better and better. And then when they get to the point where they're ready to reintroduce and test foods that they've been avoiding for the last month. So let's say, okay, today we're testing wheat. They're in the last month that they've been doing all these other things with you, they're starting to feel better and better and better. And then when they introduce a food that their body responds to, they will really have an even more clear experience that is either the food that is fine or a food that is not fine, because you have been working on all these other stuff together, right?
Yeah, absolutely. And for some people that are really sick and have significant autoimmune disease, we might do 60 or even sometimes 90 days of a paleo autoimmune protocol to really, really, clear their slate before we start kind of reintroducing back towards a regular paleo first. But yeah, it's definitely a process.
I always find it funny when someone says, I tried being gluten free for a month and it didn't do anything. So I don't need to.
Right,
And it's like, well, what else did you like? What else did you do? Because, like you said, there's so many other things, and some people may not, necessarily be gluten sensitive, but the damage is done through
right,
it's a food that our body doesn't respond well to as humans. It's been
right,
proven, but also what now we see is glyphosate, the Roundup, the
right.
pesticide is just it's basically anything you're eating with wheat is just soaked in this pesticide, and so I've got to wonder, like, how much of this is pesticide overload and how much of this is food sensitivity.
Yeah, and GMOs. I mean, there's lots. I mean, I'm sure you've talked to lots of people too, Ashley, that, I get reports all the time from patients. I went to France or I went to Italy and I ate the bread or the pasta or the pizza and I felt fine. I can't do that here though. you
Right.
know?
Right. I became gluten-free 7 years ago, and it was very early on, maybe within 6 months of going gluten-free. I was walking down the gluten-free aisle of my health food store, and there's this woman standing there kind of bent over staring at stuff, like really confused, deer in the headlights. And I felt like a gluten-free savior, a crusader. And I came up to her and I said, can I help you? I've tried everything here. And she said, my sister-in-law is from Norway, and I think it was Norway. It was one of those,
Yeah.
countries in that area. And she said, my sister-in-law can eat anything when she's in Europe. She comes here, and last time she was here visiting, it hospitalized her to eat bread. She was in
Wow.
the hospital. That's how sick she became. And so they figured out that she's just like serious allergic to whatever is in our food. And that also contains gluten. So they're like, well, we're just being really cautious. And she's coming to visit again. And we're buying all gluten-free stuff. Or no wheat, barley, or rye, or oats for her because we're really concerned about that. And it hit me like, how different is it? So I started talking to my friends because I've made friends from around the world doing all the different trainings I've done, and sure enough, I've got friends in Europe that say, yeah, when I come to the States, like, or I can eat all the pizza I want in Italy, and then when I come to the States, I can't eat any of the grains. I just feel horrible.
Yep.
I thought, wow, what's going on?
Yeah, exactly. Light bulb. Totally.
Yeah, yeah. So there you are in your clinic that you've been doing this for a few years, helping people in that Scottsdale, Paradise Valley area of Arizona to gain their health naturally. And you started to see more and more autoimmune patients come in. Do you think it's because you attract autoimmune patients, or do you think it's because autoimmunity is now such a common issue?
Yeah, I mean, it's definitely on the rise. We know that statistically, autoimmunity is on the rise. And so I think that's just part of it. I think, practitioners of all kinds are probably seeing more autoimmune disease. But I think, in doing functional medicine, that functional medicine has done a great job, I think, attracting autoimmune disease patients because there are patients that, they're when they're told, okay, here's this medication we have for you that's going to completely shut down a part of your immune system. But by the way, you could die of an infection from a paper cut or a cancer. you know, they are seeking other options, and so I do think it's definitely functional medicine's a little heavy treating autoimmune disease patients for that reason. And honestly, Ashley, I love autoimmune disease patients because there's a good degree of reversibility in treating them, which is awesome. And I can, give some great examples of, patient cases with reversibility. And notice I didn't say cure, because if that person goes back to the same conditions that flipped on the autoimmune disease to start, of course their autoimmune disease is going to come back, you know?
Well, I mean, I used to have diabetes and I no longer do. Type 2 diabetes. And I reversed it naturally with lifestyle changes, diet changes,
Right.
supplements when needed. And here I am today, super healthy blood sugar. I think I was like 4.7 on my
Nice.
yeah, on my
A1C. Yeah.
yeah, A1C. I mean, it was like I am happy with that. And if I went to McDonald's every day,
Yeah.
and ate whatever the crap is, if I went through drive-throughs every day,
Yeah.
I could recreate diabetes. But I wouldn't say that. I mean,
Absolutely.
that's the sort of the thing is that I could break my arm if I wanted to with a hammer. I don't know, that whole like discussion about curing versus reversing.
Right.
So I cured my broken arm, but then if I hit it with a hammer again, I'm gonna have a broken arm again. So we
Right.
just have to stop hitting ourselves with the
Right.
hammers.
Right, exactly. Exactly. And yeah, so there's, I've, got just this week I had a Crohn's disease patient, and he's a, young guy, not even 30 years old yet, that came to the practice just under a year ago and was on Humira and said, like, hey, I don't want to be on this. He had a bad Crohn's disease flare and was placed on it, and said, hey, I don't want to be on this, what can we do? And so we did, like, went through all of the functional medicine things that we were just talking about, and he responded really well. And we teamed up with his GI doctor, and he had a repeat colonoscopy just recently, and the doctor said, yep, you have no evidence of Crohn's disease anymore. Come back when you're 50 and we'll do a screening colonoscopy. And he's been off Humira for like 4 months.
Oh,
So
wonderful.
it's, yeah, it's possible. And, there's other little, some of the other things you were talking about with, foods, and how, if you're feeling really good, and then if you eat something off plan, it can really trigger an exacerbation. And I have this wonderful MS patient who I love her dearly. She is so funny. I have a great time every time she comes into the office. And but it's very clear. She very clearly describes when she's on her food plan and on her entire functional medicine plan. She's great. She doesn't need a wheelchair. But last time we met, she's like, I got to tell you, Dr. Park, like, I was a bad girl, and I went and we went out and had Mexican food, and I definitely had corn, and I definitely had dairy and some legumes. And then she had to use her wheelchair for the next few days. I mean, literally, this is the stuff that makes the difference to whether she's in a wheelchair or walking on her own. And so that those are some pretty profound examples of how things is how something as easy as changing food can make a significant impact on health.
Oh, I love it. I'm so excited for the listeners who have an autoimmune condition. I've been told by their MD that it's genetic and there's nothing to cure it, and they need to take this drug for the rest of their life to suppress their immune system, and there's no answers for them. That's what they've
Yeah,
been given. When
I know.
it was like 2004, my roommate, he was like 6'7", and he had such bad Crohn's disease. He ended up in the hospital. He became 90 pounds, and he was skin and bones, and they were really afraid that he was going to die. And so they were getting him, getting it all under control with a bunch of medication, but they said to him, you really need to start, gaining weight so you can have as many pizzas and as much
Oy.
milkshakes as you want. And so he came home and he was so excited because his diet prescribed by his MD doctor was milkshakes and
Oh
pizza.
God.
He still has Crohn's disease to this day. I was trying to tell him that there's a better way, but I mean,
Yes,
when a doctor says this, when because they in their training, God bless
I
them, in their training,
know.
there's no connection between food and Crohn's disease or food and healing the body. There's a disconnect.
Totally. And that's a great point, Ashley. I have to remind my patients all the time. I'm like, look, I went to medical school too, and they did not teach us this information. So your doctor's not, being a bad doctor. They're not a bad person. They're not dumb, or they're not, it's just was not in our traditional curriculum. And, I have to remind them, I went and sought out specific training in functional medicine to learn about these things. And if, your traditional doctor doing insurance care is not, unless they've sought out this education, that it's just not taught to them. So, don't, I have to remind people, like, don't be angry with them. They're doing the best they can. We all went to medical school to help people and, heal people. But yeah, there's totally a better way. And I also love to see people as early on and as young as possible, because many times with autoimmune disease, when we check labs, you can see the markers for autoimmunity in the blood work before someone has significant symptoms and organ damage. So that's like a golden opportunity right there to reverse that autoimmune disease process.
That is really exciting. Tell for those who have autoimmune, um, what steps can they take today to begin to make positive changes to reversing and no longer having autoimmune be an issue in their life?
Yeah. So it's everything we were just talking about with going through the food elimination plan. Like I said, I do love a paleo construct. And if you have an autoimmune disease, I would, look into and highly consider doing a paleo autoimmune protocol. If you're looking for great resources specifically on AIP, I love Dr. Sarah Ballantyne, the Paleo Mom, and her website's just thepaleomom.com. She has an amazing actual full program on AIP lifestyle. So nutrition is obviously one of the biggest things you can do, but we can't leave out getting enough good quality sleep and stress management. And so, having a daily relaxation practice is a huge part of the healing process. And actually for all of us, really, because we all kind of spend too much time in, the sympathetic nervous system side, that fight or flight. And practices like meditation, deep breathing, yoga, tai chi, qigong, they calm down the sympathetic nervous system and they raise the parasympathetic nervous system. And then also just, general toxin reduction. And so these are things like, taking a look at your personal care products and your household products. And, you mentioned a big one, Ashley, right? Like with food, glyphosate. So this is where eating organic comes into play. And, you want to reduce the total allostatic load on the body. And so what that means is the sum of all stresses on the body. And so you want to make sure you're doing things in each of those areas. And that download that I talked about, the 3-week jumpstart, is going to have details on those lifestyle factors in it.
Excellent. And we'll make sure that the free downloads you're giving the listeners are going to be in the show notes of today's podcast at learntrail.com. So you guys definitely want to take advantage of that. So you can get connected with Dr. Emily Parke and all her really awesome resources. Um, you'd given us a really great example of what aha moment you had when you were going through your training at the Institute for Functional Medicine, which was the what actually causes, or the root cause of how to heal GERD, or how to heal acid reflux, versus the allopathic take a pill for it. What other aha moments totally rocked your world during your training?
I think the effect of nutrient deficiencies and toxins were two other huge areas that was like, whoa, that is completely missing. And especially the nutrient deficiencies and how they affect the body. And because I'll give a great example. So let's use vitamin D, right? And, vitamin D is crucial for so many reactions in the body. It's actually a hormone. So there's a receptor for vitamin D in every single cell of the body. But generally, people think of it like, oh, okay, it's for bone health. It sure is. It does help control your calcium absorption, but it's also super important for your immune system and brain health. And it's just integrated into so many functions. And the concept of looking at, when you look at laboratory values of looking at normal versus optimal, is a big one in functional medicine too. So in traditional medicine, if it's not inside, or if it's not, if it's not outside the, quote, normal range, and for vitamin D, traditional labs start at the bottom anywhere from 20 to 30, all the way on up to 100. And so if your vitamin D comes back at 22, they're going to say, oh, it's normal. But we in functional medicine, we're always aiming for optimal because it always seemed crazy to me that why would we sit around and wait and do nothing until the labs are abnormal to do something about it. No, if you're heading in one direction or the other, it's a great opportunity to do something about it before you get into trouble. So, like looking at like the D example, if someone's D is 22 and they're in front of you with an autoimmune disease and, they have some depression and, they have some brain fog and so on and so forth, then yeah, correcting that nutrient deficiency can turn someone around in a big way. And D is just one example, but I see this all the time with B12 especially and folate. I'm seeing a lot of iodine deficiency recently too. Zinc is another one. And, I could go on and on, but that part is completely missing in traditional training, so much so that like we're really not even trained to check a lot of those, let alone know what normal versus optimal is and how they might be affecting the body.
Have you ever tested someone, because you've worked with a lot of patients, done a lot of labs, have you ever tested someone and they had no nutrient deficiency, or as pretty much everyone that you see is deficient in something?
Because I do actually have a small collection of, I would say, relatively healthy patients that are already on, they're already kind of treating themselves and they've got a great lifestyle and they just want to stay optimal. So I, see that occasionally, but it's very rare that every single person has 100% of nutrients in the optimal range. There's usually kind of some work to do. Now, if you're just outside of optimal, again, not normal, optimal, then we're always having conversations about food. Like, okay, hey, where can we get this in the diet versus taking a pill? Because, yes, supplements, are better than medications for a lot of reasons, because obviously they come from natural sources and so on and so forth. But I still don't love people to collect pills of any kind. So we always kind of look at where can we be getting this in food. But if someone has a significant deficiency, then you actually do need to supplement for a period of time to, fill the tank, so to speak.
Mm-hmm.
And then you can, hopefully maintain a good level with, nutrition. And of course, if you've healed the gut and optimized digestion and absorption.
Excellent. I love your answers. They're so, grounded in reality and science,
Yeah.
and that's wonderful. Um, there's part of me, there's this little voice inside me that really wants to shine a light on why is it that getting treated by you versus going to a standard medical doctor is so different? Why is it that their training is so void of this clearly science-based, you know, like functional medicine is science-based and is so helpful and helps people like heal their body. Um, and why is it that thousands and thousands of doctors are only taught drugs and surgery, and completely they have negated anything that has to do with nutrifying the body or supporting the body's ability to heal itself in medical school? Why is that?
Yeah. Gosh. Oh, this is a Pandora's box.
This little voice inside me says we got to go there. We got to shine a light on it. Not and I really want to say this isn't to put medical doctors down.
Right.
It's
Yes.
they wanted to be healers. They wanted to help people.
Right.
It is the system that was set
It's
up
the system.
150 years ago.
Yep.
That has the system that's been, there's trillions of dollars in the system designed to keep medical doctors
Yes.
training towards pharmaceutical drugs.
Yes. 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 Yeah. So that is definitely, that's definitely, I think, an issue. And was indoctrinated just so many years ago. And I think that's part of it. And then the other part I think another part of the answer that you'll hear from, medical schools and whatnot is they only have so much time to teach, X amount of curriculum. And this has been studied that even I think it was, I don't quote me on this for sure, but it's something like only 25 or 30 hours of medical school curriculum is supposed to be towards nutrition. And a good percentage of schools have trouble even meeting that requirement. So I think it's the double whammy of like, okay, how much time do we have and how long do we need to make medical school? And it's been influenced so much by, big pharma, that it's really hard to, I think, undo.
Well, and how many hours did you have to invest in the Institute for Functional Medicine?
Oh my gosh. I don't even know how many, continuing medical education hours that was. It was just, it was a good, almost like I was saying, almost 2 years of, training and
Yeah,
education.
that's
And
true. We couldn't make
yeah,
medical school would be like 11 years of higher education instead of
I
8 or whatever.
know.
Yeah, it's frustrating. I see the conundrum. I learned about the Flexner report where it's like 150 years ago Carnegie paid a man to go around by the US with coach and buggy, to collect all the names of the people practicing allopathic medicine, pharmaceutical based medicine, so that he could sell more of his pharmaceutical medicine back then. And he went to all the medical schools at the time and said, if you stop teaching herbs and homeopathy and all the natural stuff and only teach this medicine that utilizes my drugs, I will donate $1 million. I'll put a library on your school or whatever. And so he went around strong armed and donated and basically used his money in politics to snuff out many of the holistic schools and to influence these schools to only teach something that would push the drugs. And that's basically been kind of stuck around for 150 years.
Wow.
So it's go where the look where the money is, right? And so
Yeah.
we can, instead of getting angry at MDs, which is futile because they want to help.
Yeah,
And when
absolutely.
they discover how great functional medicine is, they're flocking to it, right?
Oh, definitely. Like, I can't tell you, Ashley, how many phone calls I've gotten from like previous colleagues. Hey, I love what you're doing now. Like, how can I do that? Like, I'm burning out from what I'm doing. And I mean, I can't tell you how many of those phone calls I've taken in the last 3 years.
That's that fills me with joy. I am so excited to hear that. I would love it if every medical doctor became a functional medicine practitioner. If no matter where you went to, you had that level of treatment. I think the whole world would be a different place if we could help people get off of, if the goal of every doctor was to get someone so healthy they became off of their medication, they no longer needed, or they minimized their medications as much as possible, healthfully,
Yes.
safely. That, I mean, could you imagine what the health of the world would be if that was the goal of every practitioner?
Absolutely. And that's like another key concept in functional medicine. I tell my patients all the time, as cool as it is to hang out with you, my goal is to not have to hang out with you so much. Right? It's like I want to get you to a point where you're doing so well, you don't really need me or any other doctor on a regular basis. You're in here maybe once or twice a year for us to, do preventative medicine. Like that's the
Mm.
goal, is to turn everyone's care into preventative medicine instead of, reactive or, treatments.
I'd love to touch on a few really like common things. So, we'll just do like a rapid fire. So I'm going to name some common stuff and you can tell us like what we could do generally, just generally good things that we could implement in our life to support ourselves. So, high blood pressure.
Yeah. So that's another big root cause one that you have to kind of look at where it's coming from. Assuming that someone's had a traditional medical workup and they don't have kidney disease or something alarming like that, or renal artery stenosis, um, then, or, and I've had, all of those have been crossed off the list. You have to kind of look at, like, okay, well, what is it? Dietary? Is it, are they overweight? Are they having high stress? Are they not sleeping well, not getting enough good quality sleep, and or, sleep apnea? That's a huge risk factor for not just high blood pressure, but cardiovascular disease risk. And so, doing everything you can to mitigate those factors is a big one. And then, of course, obviously, general, stress reduction, that daily relaxation practice that I talked about. There's great studies on blood pressure actually. If you go to the American Heart Association's website right now, there's a recommendation for meditation for anyone whose blood pressure is 120 over 80 or higher. I mean, it's there and there's good, medical studies to support it. So that's where I would go with that first. And then of course, are there supplements, that can lower blood pressure? Sure there are. And magnesium's a very, common and well-known one, because the magnesium deficiency is actually a pretty common, unfortunately. And so, yeah, those are areas I would look at.
That's so great. Thank you. A magnesium, I don't know if you've heard of this. There's a magnesium foot soak that you absorb grams of magnesium in 40
Yeah.
minutes. I started doing it with my husband a few months ago, and we noticed a huge difference right away. And I put it in my son's bath, and we've been taking, like really good multi-mineral supplements that include magnesium in liquid form for the last 7 years. So I don't think we have a magnesium deficiency at all. But this stuff, man, oh my gosh, we get such good sleep. And my son, who's a 3.5-year-old, and he, if he would choose to be a night owl, he would choose to like be a vampire and never go to
Aw.
sleep. If he could, I don't know where they get their energy from, but right? But that's how we're all supposed to be. We're all supposed to be like 3-year-olds with
Yeah.
tons of energy. And I started putting it in his bath at night, and he goes to sleep without fighting us. It's like a dream come true. I can't believe how cool magnesium is.
Oh, definitely. And there's, are you using just Epsom salts or is it
No,
some
it's
other
actually not
concoction?
Epsom salt. It's
Ooh,
a concentrated. I'll send you the information. It's a
yeah.
concentrated. I'm gonna actually have the founder on the show next week. She sourced a concentrated form of magnesium, just pure magnesium. I believe it's magnesium citrate, but it's pure concentrated from some obscure sea in Europe or something. She'll talk all about it on the
We'll
show.
find
But
out.
I
Yeah.
I, I met her a few months ago, and my friend with cancer, the one I told you about that I gave my biomat to, turned me on to her lecture, and so we went and met her in person, and I was really blown away by how much you can absorb in the 40 minutes of soaking your feet. And so I'm like, okay, well, is this real, right? And so my thing is I've been dealing with heavy metal toxicity, and so I've been doing the sauna, the sunlight and sauna,
Ah,
and
yes, you're losing your minerals. Yeah.
right, and chlorella, and I'm doing stuff to try to help get it out of me, the minerals or the heavy metals I should say. Well, I put my feet in the foot bath. Well, while she was giving her health lecture, she gave us all free foot soaks, and within
Love
minutes
it.
I could taste heavy metals in my mouth.
Oh,
And that
awesome.
was like, because the mineral is supporting the liver to do stuff, it's supporting the body, and I could really tell I was having a heavy metal detox just sitting there. And then of course got really felt totally high at the end. I just felt so like mellow. It was like I got an IV. It was as strong as getting like an IV, and I just felt like mellow and high, and I was so grateful. My husband was driving, and he chose not to do the foot soak intuitively, which is great because I think we would have just been like zonked to drive home. And
Awesome.
and I was like, okay, we got to buy a few bottles of this stuff. And sure enough, we did it. And every time a friend comes over, we like pour them a foot bath and say, now you have to soak your feet with us. It's just been so
That's
much fun.
great.
We all sit around soaking our feet. But yeah, everyone that's been doing it has noticed a difference. And I love it because so many people are intolerant to magnesium. It's really hard to get filled up, to get like the red blood cell magnesium test, to
Yeah.
get it past 5, to get to 5 and up, because you take 600 milligrams and then you have diarrhea, or you know what I mean. So people can't get
Yeah.
enough in. They're not absorbing it, or it's causing it to go through them, and so, or it doesn't even break down because it's not bioavailable,
Yep.
and it's not in our food, or they're not eating enough leafy green vegetables. And so I love this concept of being able to soak in it. I've tried the
Yeah.
sprays. The sprays never did anything for me. But yeah, this woman, her company is called, it's like the world's longest name. Livingthegoodlifenaturally.com is
Okay.
her.
Got it.
Yeah, that's her, livingthegoodlifenaturally.com. And then so it worked so well, like I contacted her, and I said, you have to give my listeners a discount. And so I'll get
Yay.
I'll be sure to give you all that information. But the discount was LTH is the coupon code. I think it's 50 10% off, I think she gives the listeners. So because it's And then she discounts the shipping, which was really cool. But yeah, I love that
Yay.
stuff. And I love that you mentioned magnesium because that helps people with sleep. That lowers the blood pressure if the blood pressure is the issue. Now, if someone, this is a question that came up to someone said, what if I have low blood pressure? How do, should I not take magnesium?
Yeah, so if so I would also look at like, well, why, do they have low blood pressure? Like what's going on with, cortisol, for example, and hydration and their, salt and other mineral balance. I would look at correcting those issues first. But typically, in my experience, it's not that, if you actually have a magnesium deficiency and you supplement with magnesium, it doesn't tend to further lower people's blood pressure significantly. And so it's one of those things where if you have a magnesium deficiency and your blood pressure is high, curing the deficiency can help lower your blood pressure. But it's a person that has normal blood pressure and a magnesium deficiency, it's not going to make them suddenly hypotensive.
Got it. Thank you for clarifying that.
Yeah, sure.
What about acne, adult acne, for example?
Oh, yeah, big skin gut connection. So, and toxins there too. So, I would definitely, obviously, the nutrition plan we've been talking about this whole time, putting someone on an anti-inflammatory, nutrient-dense food plan, to see if there's not, a food sensitivity issue with the skin. But then also, obviously, you want to grow the good, healthy gut bacteria, your beneficial flora, which is, where that 8+ servings of plant foods a day comes in, as part of any plan, not just a paleo plan, but as part of any, healthy food plan. So you want to concentrate on growing the good gut bacteria. Yes, you can take probiotics, but probiotics don't actually seed the gut like a lot of people think. And if you think about this logically, we have about 100 trillion or so gut bacteria. And if you take a really high dose probiotic, like 100 billion, it's still kind of a relative drop in the bucket. But what probiotics do is they are known to modulate the immune system inside the gut and create an environment so that your healthy bacteria, like your lactobacillus and bifidobacteria, can flourish. So I would,
Ah.
so gut, skin connection, and then of course toxins. So you want to look at your, personal care products. Like what are you putting directly on your face? And if you're a female, it's really complicated, right? Like we've got all these, the hair products and, shampoo and conditioner and makeup and our face lotion and all of that stuff. I think there was a statistic was something like the average woman puts on like 85 chemicals to her body before
Ugh.
she leaves the house. It's something staggering like that. And so you could certainly be having sensitivities to those products. So those are the two big areas I would look at with acne. And then of course you think hormone balance too.
Do you have any brands, like cosmetic brands that are really clean that you just love?
Yes. For skincare, and they actually have body care products too. There's a great brand called The Body Deli. And it's just thebodydeli.com. I love them. They're actually a small company outside of Palm Springs, California. I've actually visited there years ago. I visited their kind of home office, so to speak, and got to talk to one of the owners. Their products are raw organic superfoods, and they literally make them in batches. And so and we used to sell some of their products here at the office, and we call for an order, and they're literally like, "Okay, we'll get started on it." Like they're making a batch for you.
Oh, that's cool.
um, which is awesome. But they'll ship anywhere in the country, and some of their products do need to be refrigerated because it is raw organic superfood. But I love their face products. I cannot get away from them. I love to try new things all the time, and I'll try something else every once in a while, and I'm always back to the body deli. So yeah, big fan of them.
That's really cool. I have scoured the earth for a good deodorant, and I finally came across
Ooh,
one. I
yeah.
will
What do you
share it.
use?
This is my gift to share to you. I'm gonna go check out the Body Deli, by the way.
Got it.
So I interviewed a woman. This is, I don't know, 100 episodes ago. This feels like a millennia ago. This really awesome woman who created a goat farm with her family, and so it's called goatmilkstuff.com.
Love
And
it.
so she's got like a bunch of teenage boys, and her deodorant works on them. And so
Nice.
she's like, if it works on them, so they have a bunch of different flavors that are all essential oils, and I've discovered that my two favorite, I've tried them all. I don't like the cedar because it's so manly. So if you're buying this for a
Okay.
man, buy the cedar, because every time I lifted my arms, I'm like, I feel like I'm smelling a man's cologne. And
Awesome.
I was like, I don't want to smell manly. I'm tomboyish enough. And so
Yeah.
it's lavender was a really good one. And my favorite is the citrus. I think it's like citrus tea tree or something, but citrus. My citrus one, the citrus
Yeah.
one's the best. And this is the only all natural deodorant that lasts for like all day. Like, but if you have a
Yeah.
really long day, like you had an exercise class in the morning and you're going dancing at night, like you should do two applications. But
Yeah.
it's not like I've tried those crystal ones where in 2 hours you're just stinky.
No, I agree with you.
I was
Yeah.
the stinky hippie until I finally found the goatmilkstuff.com. So yeah, they um I can't remember if they give us a discount. You probably listeners could probably call them and see if they'd give a discount
Cool.
for the Learn True Health listeners, because I know she gave us something. I just can't remember because it was like a year ago. But yeah, the unbelievable deodorant. I was so, and I'm impressed with their soaps too. But because they make I haven't really gotten into a lot of their other stuff, but they make all kinds of stuff that has to do with goat milk. There's no goat milk in the deodorant. It's
Got it.
but yeah, but they were just looking to fill a need. They created their own laundry detergent because they were looking to fill a need, and it gets all the stains out of all they work on a farm, like, they're dirty. And she
Yeah.
goes, I've got teenage boys that play in the mud in the farm, and they're all natural, goat milk derived laundry detergent gets it out. So I thought that was really cool. I'm always a fan of learning about new products that we can get that are natural, that are safe for the environment, that are safe for our body. So thanks for letting us know about that.
Yeah.
What about people who have cravings that are thwarting their efforts? So they have all the best intentions in the world, but then like at 11 at night, they have to have chocolate, or maybe they're driving around and they just get this major craving for something. It could be alcohol, it could be sugar, it could be caffeine, it could be just, they feel like cravings are stopping them from their success.
Yeah. So when there's cravings, couple things. One, ideally you want to stop and take a second and think about where that's coming from, as in, is it an actual food craving, or is there something more mental emotional going on that's driving that uh, feeling right then? Because that's very common, right? Like medicating ourselves with food is very common. And then I would also say, if you're having cravings on a consistent basis, you want to think about, what was the last thing that you ate, and has it been too long since you've had your last meal, and was your meal a fast food meal? Was it something high in sugar? Like, what is possibly creating that craving? So I ask people to kind of go back and look, because we should all be able to make it a good 4 or 5 hours in between meals. And so if you're not able to, then you really do want to go back and look at what was your last meal or two. And then you might want to adjust, let's say, increase your healthy fat content, or maybe you're not eating enough protein, or, and it's different for everybody. But I would say, you definitely have to go back and look at, what you've eaten the last meal and or the last couple meals, and make some adjustments moving forward. And of course, the big no brainer is, are you just really thirsty? Like, are you dehydrated? Did you not do a good job drinking water that day? And so, I always ask people to, try drinking some water first before you reach for your, snack.
It's such a great observation, because you're right. Like, I know that 90% of the time I'm eating like super awesome healthy foods, but once in a while, like there's this great pizza joint that has gluten-free, dairy-free pizza. They're little like thin crust, but it's still a lot of complex, or a lot of simple carbs.
Carbs, yeah.
It's a lot of bread. And regardless of what it's made from flour. It's been processed.
Right.
Flour, in order to make flour, you have to remove fiber and a bunch of other good stuff. And so yeah, I'll have one of those once in a blue moon. And I noticed for like 3 days, I am just, all I want is to go, I don't know, eat Twinkies and drive-throughs. Like my
Right, more.
brain was hijacked for like 3 days. I just want more. I just want more. And I'm like, what is this? Like, it's crazy. And I can't imagine how many people out there will like go to McDonald's for breakfast or for lunch, and then for days every choice they make around food is actually been hijacked, been dictated by that one bad meal.
Yeah, and sleep is actually really important for food choices too. There's been some good studies on that. There's a study I read, gosh, I think it was like several months ago, saying that not getting enough good quality sleep, you will automatically eat about 300 more calories just without even thinking about it.
Yes. Yeah, and if you stay up late, you're likely to have a second dinner.
Yeah.
And
Yep.
that's the easiest way to gain weight, is to just eat more after dinner.
Right. Totally.
The best way to lose weight, go to bed at 9 p.m.
Right. Right. Yes. You kill two birds with one stone, right? You're getting
Right.
enough good quality sleep and you're, taking out that late night snack.
Exactly. It has been such a pleasure having you on the show. I really want to have you back. This has been so much fun. You are such a wealth of information, and you're so much fun to learn from. Thank you so much for coming here today.
Oh, Ashley, thank you so much for having me. It was a blast, and would be super happy to do another interview with you anytime.
Yeah, absolutely. Now, before we wrap up, I know that sounded like a wrap up, but psych, we have to talk about we have to talk about your
Love it.
website, dremilypark.com. That's Park with an E, so I'll just spell it out: DREMILYPARKE.com. Of course, that's going to be in the show notes of today's podcast at learntohealth.com. When everyone goes to your website, what do you want people to see? Is there like are there recipes, or is there like a
Yeah.
resource page? Like, what do you really want people to gravitate towards when they first come to your website?
Yeah. So if you want to grab your free downloads, you would go to dremilypark.com/interview, and you'll get those two free downloads there. But I do have a pretty active blog and in writing, and I do a lot of videos as well. And so you can just click on the blog section, and there's blogs and recipes and videos. There's a lot of really great resources there.
Awesome, thank you. Now, I'm sure have been inspired today, and they want to work with you. How would someone work with you?
Yeah, so in order for someone to work with me, they have to come and see me in person at least the first time, and then I'm able to do either phone or video follow-up visits subsequently. But they would, on the website, all of our contact information is there, but you could certainly call the office or visit the website, and there's a contact us, button on there, and we, can work on getting you scheduled for an appointment.
Well, and Scottsdale is like a happening vacation spot. So they could come enjoy, have a little vacation, take the whole family and go see you.
Yeah, I highly recommend coming sometime between January and April. Those are the
Nice.
best. Those are our, awesome resort type months here. There's just, it's pretty much 75 and sunny every day, and there's so many amazing things to do here.
Well, but for people who live in Canada, for example, even coming in November is still like a break from the
Right?
snow.
Totally, totally. Yes, that's true.
That's right. You've like it's going to be about, I don't know, 50 degrees Fahrenheit, and Canadians will be in shorts and a t-shirt, like just barbecuing, so
Oh,
they're so
definitely.
happy for that break in the weather. Oh, that's awesome. To wrap up today's interview, what would you like to share with the listeners? Is there a piece of advice or some homework you'd like to leave with them?
Yeah, I would say the top thing you can do to create health for yourself is to think about how you can lower your stresses and make your life simpler. I think that's, it's like a badge of honor lately with, how busy we all get. And, I think anything we can do to reduce stress and simplify our life is going to go a long way.
Beautiful, wonderfully said. Thank you so much. Please come back on the show. I'd love to have you back.
Great, Ashley. Thanks you so much. Have a great day.
Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com, and one of our fantastic true health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.